Miss Escobar. Thank you for meeting with me today. I know we had quite a day. I just wanted to discuss and go over some things with you. How are you doing?
I'm good. A little tired, but I'm good.
How's everything been going? How's your clinical experience been so far?
Well, we just pretty much got out of observation, so it's a lot to kind of take in at one time, but it's going good so far.
Good, good. Do you feel like how do you feel like you did today? Do you feel like what went well, what went bad?
Well, obviously I showed up late, which I apologize for. It won't happen again. It was just one of those things that my alarm just didn't wake me up and I just snoozed and I kept going, unfortunately. So of course I'll work on time management.
Mm.
I was kind of embarrassed when I went to go give that patient Ancef when they had a penicillin allergy.
Yeah,
So I know that's something I should know, but I just honestly I didn't make the connection.
yeah.
And the emergence, I feel like I'm just not getting it. I don't really know the process of it or how to go about it or kind of assess the patient when they're coming out of it. So I definitely need help with it.
Yeah, no, and like especially where you are right now in the program, like that's totally normal. That's expected. We all need time to develop our flow, and yeah, absolutely. That's like the last thing that you'll be able to solidify once you understand your flow is like learning emergence and those cues, and yeah, just paying more attention to details like the ephedrine, and we'll talk about like vent settings and stuff like that. And yeah, time management is huge. So let's go over the eval and we can just discuss it then and see some of the things that we can improve on. The first part of the eval is setup and preparation. So like as you mentioned, you did get there a little bit on the later side. 6:45 is just not enough time for a case like this. It was a 7 a.m. start at Sinai, and a cystectomy will go at 7 a.m. And you need to get there early. Like I got there at 6 a.m. And it's just good habit, especially when you're starting off. It may even take you a little bit longer. So, just read up on your cases the night before and get a good idea. Look it up on Jaffe and see how long it's going to take you to set up for that case, what you need to set up for that case. Because a case like this can, on top of your anesthesia machine checkoff, checking your suction, your equipment, setting up an airway, setting up your drugs and medications. And if you need to troubleshoot something, like that's also important. You need time to do that. You need to restock your syringes and set up IV fluids. And then on top of that, you have to do your pre-op afterwards.
Yeah.
And
No, I
that all
totally
takes,
understand.
this is not possible in
Yeah,
15 minutes.
no,
So
I understand.
I understand you're running a little late today. It happens to the best of us. So just a little bit better on time management. But you did do a lot of good things when I did ask you about the anesthesia machine and fluid replacement. You were able to answer me correctly. So I do know you know your things. So for that, I'm going to have to give you like a 2 just because we can work on time management. Um, the next part kind of goes hand in hand. The second part of the eval is pre-anesthetic. So, getting there a little bit earlier on time is going to also give you more ample time to talk to your patient, discuss with your patient. You did do a lot of good things. Like I did see you use 2 patient identifiers. You checked for consents, you introduced yourself, you built rapport with the patient, you even got the IV. You did very good with all those things. However, like I said, getting there on time, you'll notice certain things like on the pre-op, if not, like, during the timeout, you'll see that the patient had a penicillin allergy. So, and you still drew up Ancef. So, little things like that. Like, I'm gonna have to knock you on that one too. I'll give you a 2 for that part of the eval. And then the third part is the plan of anesthesia care. So like once we see that the patient had a penicillin allergy, we have to assess how those things pertain to our anesthetic and how they're going to change and modify our plan of care. So at this point, we could have like talked to the surgeon and then discussed different options, alternatives of what else we could give, for the patient safety. But other than that, you were able to discuss with me that you wanted to do general anesthesia and we could have done an epidural for post-op pain. So you did know you were in the right track. So the next part is the knowledge base. So with the knowledge base, I kind of want to touch on this a little bit. When I asked you why giving Ancef to a patient was not good for a patient with penicillin allergy, you did answer me correctly, which was good. You were able to apply your didactic knowledge to patient care and you maintained basic priorities. For example, you understood that ephedrine, you reached for the ephedrine when the heart rate and the blood pressure was low, so that was good. But when I asked you to give 5 milligrams, you gave all 5 cc's. So that could have been an error on both our parts, communication. But if you didn't understand that 5 cc's was 5 milligrams, maybe just pay closer attention to the label or ask me, confirm with me if that's really what I would have wanted. Just because this is very sensitive, like a 5 cc's, 25 milligrams of ephedrine could kill like a pediatric patient if it was a baby or someone with very bad heart history. It could have gone very, very bad. So thankfully, nothing terrible happened. But just for that, I'm gonna have to give you a 2 on this one too. Um, For the next part, it's application of knowledge. So like I discussed before, you were able to do a lot of good things. You were able to calculate the right doses for induction, for fluids, and you were able to titrate your anesthetic to keep a good MAC for the whole case. However, with the actual vent settings, we probably could have done a little bit better. You put the patient on volume control. So when the patient went into steep trend, the peak pressure shot up. They went into the 40s. And that was an expectation. And even if you didn't catch it right away and change the vent settings, when I asked you why that was happening, you couldn't answer me why. So like again, you're starting off, so it's normal to not make the connections 2 and 2. Sometimes like we read it, we understand it in the textbook, we're able to answer it on the exam, but when we see it in person, it just doesn't click right away. So, next time we're in the OR together, I don't mind like going over some of these things with you, and we can talk about what's the best mode for certain positions and why. So for steep trend, obviously the pressure is going to push up and it's going to shoot your peak pressures. And then the next part is psychomotor skills. So your intubation and induction was very good. You followed all the right steps. You pre-oxygenated well. You got the tube in. You got the patient comfortable. However, your emergence, like this needs work on. Obviously, like I'm sure you've seen it done a million different ways. So this is like the last thing that's really going to click. So I don't expect you to be a pro at this by any means. It'll come with time. At your level, you just work on assessing, and talking out the steps as you need to go. One of the things would be for muscle strength, for twitches. The patient had 0 out of 4 twitches, and you gave Neo and Glyco for the reversal, which you need try to have at least 2 twitches before you give Neoglyco. For 0 out of 4 twitches, Sagamodex is the better option. So, and that's just back to farm. And when a patient is emerging, usually like putting an OPA would be the better route, just for patient safety. You don't want them to chomp down on the tube. But again, this is like emergence, like and you even, you said that that's something you need to work on. So like, I'm glad that you're able to recognize, areas of improvement. And this is why we're doing, the eval. So the last part, well, not the last part, sorry. The next part is anesthetic management, and this goes hand in hand with everything we've discussed so far. So overall, I'm going to give you a 2, just because we're still in the starting stages. So, but as time goes on, it's only going to get better. So, the connections will come. The documentation, you did an amazing job at documenting. You did everything appropriately, and you were able to give handoff and report. You knew the patient. So great job on that. Professionalism and teamwork. So this, I wanted to touch base with you. You were very respectful towards me and the staff and other students. You helped out without being asked to help. And you asked a bunch of questions, which was very good. I see that you're motivated, you're trying to learn. However, I did notice you were on your phone for personal reasons during the surgery. I understand things can happen, emergencies can happen. We all have personal lives. So just communicate with me if something is going on, so I know, and you can step outside and handle it as you need to. But other than that, if it's, you shouldn't be on TikTok watching videos. Vigilance is like the most important thing in anesthesia. So, we need to be aware of what's going on, especially like if we forgot to like turn on the alarms, the patient could be crashing and decompensating and we may not notice. So just notice, even if it's just noticing trends that things are trending down or in the wrong direction, just staying off your phone. You should always be off your phone. But like I said, things can happen. Just communicate with me if something does come up. You're allowed to use your phone though, like if you need to look something up, like something about the case, just communicate with me, okay? So for that, I'll give you I'll say a 2 as well on that one. Overall, you did do a lot of great things, but it's a work in progress, and with due time, things are going to start clicking more. The more you see it, the more you do it, things are going to only improve. You're motivated and heading in the right direction, but just it's the little things, like, because it's easy to get into like a routine and be in one, used to doing something. But you did good overall, so I'll give you a 3, and you're gonna be a great CRNA one day.
Well, thank you so much for meeting with me, and I promise I'll do better next time.